phototherapy order through EMA. The first step, which is a one-step process, the first time setting it up, is to create a contact for Phothera under document management, manage referral contacts, and we are going to add institution in the top right.
Now, I happen to already, this is Rajesh Subramani. We're jumping into a test patient here on EMA. I already had this added, but just so that all of you see how it's done, Matt's going to walk us through this here. So go ahead.
We will type Phothera under the name. The Phothera MPI will be 132 610 5842. We will click Active under the Status tab. And then we will enter the Phothera fax number 216 765 0271. We will then
this is
scroll
pretty
down.
straightforward, and then we'd hit save. Since I already have it, I'm not going to hit save here, but just know that what happens is then the referral contact will pop up, and then Matt, your point was that now this is embedded. It's a one-time step, correct?
One-time step, and that will sync across all units on the same network, like PCs, iPads, etc.
Great. Now to go to our test patient, we're going to bring up, we have a test male here, so just any old patient, and then Matt's going to walk us through this again.
So when we're in the patient profile, we'll create new visit. Then we will enter the virtual exam room. Down the left-hand side, you'll select your impression: psoriasis, vitiligo, atopic derm, CTCL.
Remember, any of these are options. I'm going to go ahead and pick psoriasis. It could be for any of your patients for any of these things. Typically, we would go in and then, pick what we needed to pick for however we do the assessments at our clinic, whether, we want to calculate body surface area. I could do something like that here. Say this patient had maybe 25% body surface area. So easy to do something like a PGA. It is helpful if you have these when you're thinking through if an insurance company is going to cover or not, because it's important for us to note, body surface area. PGA is so simple in terms of just mild, moderate, severe. And something that we forget about is the itch rating score. If you want to put it in, you can, but just in the interest of looking at how to make this order happen, then you go into the plan section. Now, I have it in my popular plans just because I do orders for Phothera. But typically what you do is you can find it by going in and typing in Phothera here, and it would just pop up. But it's already in my popular plans. So I'm going to click on this and have Matt guide us through the rest of this here.
Perfect. That'll take us to a screen here where it's a series of drop-down menus. Zone stays the same. Obviously, you will pick the skin type for your patient. Then you'll have a selection of 3 home phototherapy devices: your handheld, your hand and foot, or your full body. The frequency of treatment is set at a standard of 3 times a week. Treatment count, you have the option of lifetime. If you want to limit the exposures, you have 100, 250 as well. Process through the prescription, the patient's insurance, chronic conditions, and then a spot for your previous treatments. Obviously, as we move through the insurance, more detail, the better.
Exactly. And so for previous treatments, a lot of our patients have had topical steroids of one nature or another. And so it's really important to just be as complete as you can in terms of what's been tried before. I'm just putting in a few things here. But this is an important step so that we're able to note what's been tried. Now, were previous treatments effective or not? Maybe there were previous treatments, or maybe there weren't. We're just going to leave it as not applicable. As well, we'll say previous treatments were not effective because these were the previous treatments. That's important because if they were effective, then one of the questions would be, well, why are you going on to light? Especially if you're thinking light, likely that was an issue. Have they been treated with light therapy in the office before? I'll leave this as NA, but you normally can just choose whether there was previous exposures to light therapy or not. And then reasons for home use. This is very important because you don't want to bypass these clicks. This is one of the ways that the insurance companies and even yourself should be assessing why home therapy is appropriate. So is it long-term? In most of these patients, it is long-term. Is it not available? Well, we know that in-office phototherapy isn't available to all patients. So obviously select the right one, but this is going to be one of the reasons you're choosing home. Distance and time to travel is a big a barrier for people to come in for in-office phototherapy. And then a lot of our patients are working, or if they're in school, it's hard for them to take time off. And then what is also important is if you think copays are going to be a burdensome for that patient, make note of that. Or if they're chronic health conditions, that just prevents them from traveling. This is also very important to note. And then we want to say, is the patient reliable, motivated, and able to adhere to instructions? That's also a key thing because one of the challenges with prescribing home phototherapy is to really note that the patient is able to do this. And of course, if we're choosing this, they are typically, in our judgment, they are reliable. So make sure that's selected. And then the physician email, Matt, you had made a comment on it, so I'm going to turn it back to you. But what's your suggestion here?
Yeah, physician email is in there for a main point of contact for the office. We ask for this to be able to provide confirmation of the order receipt, if there's any missing information or additional clinical information that is needed during the insurance process while our team works on the prior authorization steps. It's an easy reach out point for us.
Perfect. And if they're adjuvant therapies, they're on any other treatments, frequently this is used as combo treatment as well. It's not just monotherapy. So you may include that if you'd like to in this section. And then in terms of location, you have a few options. In this particular case, I had selected full body because I wanted to treat the full body. So I'm just going to select full body in this case, but you can be more specific if you'd like to, for whatever reason. Sometimes we only want to treat a certain area. And then one of the things with protocol, consent, post-care, you can look at them, but it's not really needed for you to do anything extra there. And then we're done with the order. And then Matt's going to walk us through how to make sure we get this sent to Phothera in the appropriate manner.
Yeah, so once you click done, you want to go back to the visit overview with that tab up in the left there. And from this screen, you can preview your visit note to ensure that everything's captured in there. It looks how it should look. Then you can preview your order as well. And this will be the most important page from the order perspective. This is what Phothera needs to actually submit the order to insurance and complete the process for the patient to get the unit. So everything looks good there on the order, visit notes. From this section, we can click fax up on the top header there. In the to field, we just enter Phothera, which will auto-populate from that first step that we completed. Then we will go down 2 fields to the template field, and we will select the attachments selection. That will auto-populate kind of your face sheet there. From there, this step is important as it has to be done in sequence. First, we need to add the visit notes. Now, once we've added the visit notes, we can add or remove orders. And again, the sequence matters on this. If we go to add the orders first, there will be no order without that visit note added first. So once both of those are added, we can click on the bottom, include your HIPAA cover sheet, your face sheet, your summary. You can include the body diagram if you want, not necessary, and then from there you can hit preview. And this will show you what will be sent to Phothera.
So it has your note in there, and then it has the order, which is really important for Phothera to be able to actually execute the order.
Yes, that is the most important part. So it's always good to hit that preview to ensure that is attached to it. Without that attached, Phothera cannot process the order. And then that will obviously delay the turnaround time for patients and require us to come back and request that. So the preview button there, ensure that everything's attached that needs to be attached, and you're good to go. From there, you have the option to save facts to your chart upon sending. From there, you hit send, and you're good.
And that's it. Very easy. I mean, we took a little bit of extra time to show you how to do it, but in real time, it's quite easy for you or your medical assistant or scribe to really get through this and put these orders in. And the bottom line is, you don't want these orders to be cumbersome. So Phothera's put a lot of effort into making sure this is very streamlined and easy to order, so you can do it on the go while you're, seeing your patient, and you don't spend a bunch of extra time trying to put the order together.
Perfect. Well, thank you, Dr. Sivamani. I appreciate your walkthrough and assistance on that.
All right, guys. I think that was pretty straightforward,
cool.
Huh?
Yeah. Sounded great.
That was great, Dr. Sivamani. I really appreciate you